Hey everyone, and welcome to Trusted Senior Specialist. I am Sandra Ford, Senior Compliance Officer, and I'm coming to you live out of Houston, Texas. Yes, we are defrosted. We're no longer frozen. And in fact, crazy as Houston is, I would like to be at the beach today because it's that hot. Yes, this is a good day to get out and get some sun and vitamin D, something that everyone recommends, especially with the way people are getting sick these days. One thing and one trend that they keep talking about is there's not enough vitamin D in our systems and we can't get it all from the sun. So look up some foods. I did read that portobello and shiitake mushrooms have the highest content of vitamin D. So I would suggest you increase your mushroom. I'm not at all a nutritionist, but I do like mushrooms and I like vitamin D. And so, whatever it takes to stay healthy. So, what are we talking about? We're talking about the changes to Medicare. And I'm just going to talk about a couple of changes that we've seen take place on January 1st, 2021, because we've been doing a lot of videos on the series. For this quarter and going into the next quarter, we're going to be talking about we're going to be talking mostly to people turning 65, but between now and the end of March, we really want to focus on people who have Medicare and they're starting to see their Part B premium coming out of their Social Security check and see that difference. And we're letting you know how much that difference was. So that's the purpose of these videos. Plus, we are in there's special enrollment periods that are going on, especially with some areas that it may have experienced hurricanes. I know it's been a while, but wildfires. There's special election periods, and of course, we're in the middle of what's called an open enrollment period, and that's when someone has an option to make changes, but you have to actively request that change. It's not something that we are allowed to really get out and promote. But there's a lot of things that happen within Medicare. But one of the things that we don't do a lot of talking about are the changes, other than what you might receive in your ANOC, which is your annual notice of change. You get that book at the end of September, you're supposed to, from your carrier, so you know how to make a good decision coming up for the next Medicare year. But what about all the other changes? What about the changes that occurred with Medicare as a whole? So that's what I'm going to talk to you about. One of the big changes that we saw, well, let's go ahead and talk about premium. So the Part B premium for 2021 is $148.60. That is the premium for everybody who has Medicare A and B. That's the Part B premium. So if you are working and you're looking at deciding to go on Medicare, wholly and get off your group health plan, or if you got to keep your group health plan because you have an underage spouse or dependent that's on your group health plan, we do have other insurances for those folks, so we can help you with that. But if you do have Medicare and if you have group health and you're looking at going into Medicare, that premium is 148.60, and that's one time a month. That's not bi-monthly, bi-weekly. That's one time a month. That's pretty good because that covers 80% of all your Medicare or all of your approved healthcare services. 80%. Some people have a group plan that only covers 70%, but you still have a sticky, stinky deductible. And with Medicare, the Part B deductible is low. It's $203. That's it. So you pay 148.60 a month to have 80% of your healthcare services paid for under, approved services by Medicare, and then you have a deductible of $203. That's it. That's not bad. Now, I will say this. 20% of anything can be very expensive. And so when you do apply for Medicare, we can help you with that. We love helping you apply for Medicare because we know how to get that application in, get it to the right place, get it taken care of so you get your Medicare activated when it needs to be. But what I'm talking about, the the 20% of a surgery can be very expensive. So the next step is not just applying for Medicare, but it is choosing a Medicare health plan to help that remaining 20%. So that's when we talk about Medicare supplements. And some people may decide, I like the Medicare supplement. They're pretty good. They do have an additional premium, but I'm kind of interested in Medicare Advantage. And we can talk to you about what those are and how those help you because they're very, very, very affordable, very cost efficient. So it depends on your circumstance, your wishes, but we help you understand the difference between the two. So to recap, Medicare Part B premium and monthly premium is 148.60, and the Part B deductible is $203. So it's a $3.90 increase on the Part B premium, and that's a about $5 increase on the Part B deductible. Now, the deductible is always due at the beginning of the year, and once that's paid, it's done for the rest of the Medicare year. Now, if you are on a limited income, if you are looking at maybe retiring and going into a fixed income, there are programs that help cover the Part B premium as 100% or some, and even covers that Part B deductible. So if you are in a situation and you're like, that's still a little costly, that's great. We want to talk to you because we can help you apply for those services. They're provided by the state and federal government, but we help with that application processes too. Because if I didn't tell you yet, we have an exceptional customer service, exceptional, and we help people who have worked with us where we help them find their health plan. We help them with navigating how to get an authorization, how to go through appeals and grievances. We help them with just locating a doctor whenever they go to their doctor and decide, you know what, I don't really care for this doctor anymore. Can you help me? And we love doing that because a carrier is always there for you as well. But we always pick up the phone with a hello when you call. There's no buttons to push, no options. You just pick up and you got a person. That's why we brag on our exceptional customer service, and we're never going to stop bragging because they're just great. We do deliver old fashioned service. We just do. Now, let me talk about the Part A deductible. The Part A deductible this year, what is that? First of all, if you go in the hospital, if you go into the hospital, you have to pay a deductible if you have original Medicare. And why do I say original Medicare? Because if you're on original Medicare, that means you don't have a Medicare supplement or a Medicare Part C, also known as Medicare Advantage, to help with that deductible. So if you're on original Medicare, that Part A deductible is $1,484. What does this mean? If you go in the hospital next week, that's what you're going to pay for your stay. That's what you're going to pay to visit the hospital. We're going to call it that for the first 60 days. After that, each day that you're there, you're going to have a daily copay that you're going to be responsible for. At days 91 to days 149, you're going to have a higher daily copay. And once you hit day 150 in the hospital, if you're there that long, some people, you never know, when that does happen, you're going to be 100% responsible for the daily cost of being in a hospital. This does not include any services or treatments or labs or anything else. It's just your visit there. And then it's 100%. And after that, once you get into those 150 days, Medicare wants you out. So that's why we cannot stop encouraging you. I'm all about a do it yourselfer, but when it comes to Medicare, we're a do it with you. We want to be sure you have the right coverage. You're not going to be, um, you know, backed up against the corner, putting your house on the market, moving in with your kids because of a financial catastrophe because you got sick. So we want to talk to you about getting those Medicare supplements, those Medicare advantages to go into you with your original Medicare. Never stay on original Medicare unless you absolutely have to. And if you think you do, we want to talk to you. Okay. So those were the cost changes to Medicare. Okay, that was the Part A deductible and the Part B deductible and the Part B premium. One other change I want to talk about is end stage renal disease. I talk about this one a lot because it's a really big deal. Up until now, up until January 1st, 2021, anyone who had end stage renal disease after your fourth dialysis, you're able to get on Medicare. You get on Medicare regardless of your age. Now, at that time, you can only get a Plan A, and a Plan A is a supplement plan. It's very costly. It doesn't cover very much. You're kind of locked in. You didn't have any options. You had to wait till you're 65. When you turn 65, if you have end-stage renal disease, ESRD, then you can select any Medicare supplement plan within 6 months of your 65th birthday, which would help cover all costs. But if you're in your 40s or your 50s and you have end-stage renal disease, you got 12 years of a lot of cost. Now that changed. So you folks who have ESRD, and if you're helping a family member or if you have a family member and they may not be aware of this, open that conversation up or show them this video. Okay. Share the video. If you know someone or you yourself have end stage renal disease, you or the someone you know has Medicare. Up until now, January 1st of this year, they only had the option of going on Medicare Plan A. It's an expensive plan, doesn't cover much. Now they can enroll in a Medicare Advantage plan. Now, am I saying that's the best plan? I am not, but I'm saying it gives them another option. And so if they're in their 40s or 50s from now until another change comes our way, They are allowed to have something that's going to offer more benefits, lower costs, and give them access to different kinds of care. Some of these plans include that vision and dental that you always hear about. You don't get those in Plan A's. So it gives them access to more benefits, and it also gives them access to saving a lot more money. This is fantastic. Then, when that person turns 65 or you turn 65, for those first 6 months within your 65th birthday, you can join any Medicare supplement plan of your choice that's available in your area. So you can join a Plan G, a Plan N, a Plan C, your choice, whatever's available on the market at that time. You're eligible without being discriminated against your ESRD. So, what is my point? That now people who have end stage renal disease have another option that they didn't have on December 31st and prior. So, it's very exciting. I'm going to talk to you about one more big change, and then I'm going to talk to you about a scam. So, one more big change I want to talk about is the insulin. There's a lot of news out there right now that's going on. There's a couple of executive orders that we know have been on moratorium, and that's pretty typical. When someone changes, administration changes, everybody's got to review what's in place and let's see what we're going to take out and keep. Now, in regard to the Medicare health plans, the insulin is $35 monthly copay. Okay, if you have diabetes and you're taking insulin, your medication for that monthly copay is going to remain $35 for the 2021 Medicare year. So that is great news. We've heard a lot of stuff where people weren't getting their insulin, they were not getting their diabetic medication because of cost. That went into effect on actually I want to say it went into effect for some plans that people turning 65 were able to access in November and December. But overall, January 1st, all plans, pretty much all prescription drug plans. If you do have diabetes and you talk to one of our Medicare experts, I want you just to simply say, I want to talk about the plan that has the insulin discount benefit. Okay. That's the one you want. Pretty much all of them have it now, but that's a huge change in the Medicare market. It is a $35 copay for those who have to take insulin. So if you're on a group plan and that deductible is there for a prescription drug, and if it's costly, then I encourage you to talk to a Medicare expert and look at the cost effectiveness of moving off that group plan and moving into Medicare Advantage. I mean, a Medicare prescription drug plan that has that discount on that insulin, if that is the case. And again, everybody's different. Everybody's situation is different. That's why we want to talk to you. Before I talk about the scam, I want to tell you two things. Let me We have a Facebook group. It's called Your Medicare Matters Because You Matter. If you go to Facebook and you do Trusted Senior Specialist and you look for our group, you can join that group. And I really want you to. Why? Because we have a lot of people in there who are talking to one another, giving tips and advice. It's really uplifting. It's a great place to be. Talking to people who are pretty much just like you. And that's called, you go to first Facebook, Trusted Senior Specialist, and then you look for Your Medicare Matters Because You Matter. I really encourage you to join that Facebook group. Also, there's a lot of great videos in there. If you're a teacher, if you're a veteran, if you have Cobra, whatever the case is, we have great videos in there with a lot of valuable information. We deliver a lot of great, great, great information to you. I also want to give you a hotline. This is the Sandra hotline. So when you call in, we have people who work after hours. And we have people who can talk to you on Saturdays if you're still working, and or if you have someone who helps you with your Medicare, or if you're helping somebody, we can talk to you at different times than just banker's hours. The old term, if you still use that. Let me give you that number. It's 1-888-689-9701. Again, 1-888-689-9701. And then so I want you to call that number. That is the hotline, and you can talk to one of our folks and you can get any question you need answered, and any dilemma you're in, you can get a solution. Who likes solutions? Okay, I did want to mention one more thing, but I lost my notes, and that's okay because I'll have another one of these little videos, or I'll put it in at the end. I wanted to put something else on here, but I will find that in a moment. So let me talk about the scam. I think it's starting to die down now. I think we figured them out, right? I love it when we figure them out. But the COVID testing, Medicare does cover 100% of COVID testing. So if you think you have COVID-19, you can certainly get tested Where do we get tested? You need to contact your Department of Health, and they're going to let you know what clinics or what pharmacies are offering that. We know a lot of the CVS pharmacies do have the test now. I haven't yet, still yet, have seen where a physician's office has them in stock. That might not be the case in all counties and cities, but I haven't seen that where it's been put out in the public. Hey, your primary care physician should be able to give you that vaccination. I haven't seen that yet. Still, I've only saw it where it's at the pharmacies and at certain labs. But here's the scam. You cannot pay to put yourself on a list. So if someone's calling you and asking you to verify your Medicare for your shot, and they're going to charge you to put your name on that list, that's a scam. So make sure that you let them know that you've already got your vaccination. I know it's a little white lie, but hey, I already got my vaccine. Appreciate your help. I feel great. I talk to you later, and then block the number. Okay, the scams are out there. It is not even a possibility to pay for your way to get in line of any in front of anybody else. And now they're rolling out so many vaccines. I think that anyone at any age is able to get them at this point. So I hope that this information was valuable to us. I mean, valuable to you. It's valuable to us, but it's valuable to you. I want you guys to send us your questions, call our phone numbers, join our Facebook pages, go to our websites. We have a lot of bonus offers. When you talk to one of our Medicare experts, we have bonus offers. They're going to give you some great things, the changes to Medicare, the new to Medicare guide. Um, there's just a lot of great tools that we're going to pass to you because one thing about Medicare, we've spent years learning and understanding and handling and navigating, and we've seen so many wrenches, monkey wrenches being thrown in the middle of a situation, and we learned the resolve to that. We understand how most, for the most part, you can't understand 100% of it, but we understand how Medicare works and how to help you get to where you need to be. You don't need to spend that time doing that. We've already done it. We like to just give you the information that's fitting for you to put you in the right situation. So you don't need to worry about learning everything about Medicare. We have the information to give you. Just call and ask your questions, and we're going to get you to where you need to be. So, again, this is Sandra Ford with Trusted Senior Specialist. I hope that you have a wonderful, wonderful rest of the week. I know down here in Houston, it is sunny and bright. And as much as we enjoyed seeing something phenomenal as snow, and it would have been cool if they brought down a few penguins, I am certainly much happier to go to the beach and right now see a shark. I love the warm weather. I hope you guys have a great day, and I'll see you on the next live video. Thank you.